So we're going to finish the vestibular lecture. So we're going to talk about perilymphatic fistulas, and this is an abnormal communication between the inner and middle ear at the round and oval windows of the vestibular system. This is often due to a tear or a defect in the area. Signs and symptoms with this: they will stop at rest, but they will get worse with activity. And activities often include exercise, heavy lifting. However, things like sneezing and the Valsalva maneuver can also increase symptoms. The symptoms that these patients will report include vertigo, motion intolerance, and disequilibrium. Treatment often includes a surgical repair or avoiding any activities that will increase intracranial pressure. The next dysfunction we're going to talk about is mal de débarquement syndrome, and this is having symptoms related to feeling as though you're getting off of a boat. And this is often caused by spending a long time on a boat, such as a cruise or an extended train ride. These symptoms include dizziness and disequilibrium, and they're usually going to subside within a couple of hours. However, they can become persistent in some individuals and last weeks, months, or even years. And the symptoms that your patients will report include the feeling of a rocking vertigo. We don't really understand the physiological cause behind this. However, if patients have symptoms for an extended period of time, this can be very debilitating. And it will often limit their activities, and they will typically be provided medication to help decrease this sensation of rocking vertigo, but oftentimes that can make people feel a little loopy and a little out of it. They're oftentimes over-medicated. Talking about neoplasms within the vestibular system, these can occur in different locations. However, the most common neoplasm that you'll see is called an acoustic neuroma, and this will occur in the nerve sheath within the vestibular nerve. And it tends to grow slowly, and it can be fairly small and encapsulated. Symptoms will often include nerve compression and hearing loss. They'll often report dizziness and balance impairments. We mentioned in class a little bit about someone with a TBI. They will often have complaints of dizziness, which could be common with these individuals because of head trauma, but it could also be because of a peripheral vestibular injury or a central vestibular injury. And believe it or not, about 50% of individuals with a TBI will have some sort of vestibular impairment. Moving on to congenital vestibular loss. This is a change in hearing that would occur either before birth because of a loss of vestibular function. This could be related to a genetic cause. Oftentimes this is caused by an intrauterine infection, intoxication, or anoxia, so lack of oxygen. It can also be caused by different types of viruses. Looking at vascular disease, this is decreased blood flow and ischemia, and it's a common cause of vertigo. So oftentimes the vertebrobasilar artery will be insufficient, so there'll be a lack of blood supply, and this will contribute to those vertigo symptoms. And this is common in individuals over the age of 50. It's often a result of atherosclerosis, particularly to those vertebral and basal arteries. And that ischemia can also cause vertigo without any hearing loss. So hearing may not change as individuals age, but they may report feelings of dizziness and vertigo. A vestibular migraine. This is a type of migraine headache that will result in symptoms of dizziness, and it is often associated with vascular changes in the area to that vestibular structures. It is common actually in both adults and children. And approximately 30% of individuals with migraines report some type of episodic vertigo. Moving on to metabolic disorders, these include conditions like Paget's or diabetes. They can affect the vestibular system. You can see changes to both vascular structures and nerves that will contribute to feelings of dizziness and vertigo. Allergies to things like food or chemicals can often result in dizziness, things such as a food sensitivity. Oral cholesteromas, so these are cysts in the middle ear or in the mastoid. What can happen with these cysts is that they can eventually erode the temporal bone. They can be congenital, but they can also be acquired. And they will cause damage to the labyrinths and result in vestibular dysfunction. And the last comorbid disorder that we're going to talk about are malignant external otitis. This is an infection that affects older individuals, typically who are immunocompromised or patients with diabetes. And typically the infection will begin in the external auditory canal and then spread to the temporal bone. And what this does is it causes pressure, or the feeling of increased pressure, to the facial nerve. So worst case scenario, this infection can spread to the intracranial cavity and create a thrombus. However, if you remember from our last section, when we talked about pressure on that facial nerve, that also affected our patients with Bell's palsy. So the reason why we went through these different disorders was to kind of give you an idea of potential secondary causes of vestibular dysfunctions. Moving on to the treatment. Oftentimes patients will be prescribed medication such as meclizine, and you would typically encourage your patients to take this prior to their physical therapy treatment. This medication helps patients with anxiety that they might have about the treatment, but it will also help with their symptoms of nausea and vomiting. In general, physical therapy treatment and medication treatment, the goal is to eliminate the frequency and the duration of these abnormal vestibular sensations. Some of the sensations we talked about were that excessive feeling of movement, nausea and vomiting, and potentially the anxiety associated with those symptoms occurring. So specifically, some of the physical therapy exercises that we will do to treat the vestibular system include habituation, balance, and gaze stabilization exercises. Habituation exercises, they're meant to treat dizziness caused by motion or visual stimulation, not necessarily spontaneous dizziness. A lot of these kinds of exercises involve changing positions. So oftentimes you'll have a patient start in a seated position and then have them laying on one side or the other and waiting for the dizziness to subside before moving them to the other side. Balance exercises are meant to help improve steadiness with activities of daily living. This might include having your patient do an exercise standing on an unstable surface such as a pillow or foam. By changing the surface that they're standing on, it's going to challenge their balance. Adding additional movements such as marching or having your patient reach for an object or tossing a ball back and forth will also challenge their balance. Removing things like visual cues will also challenge the exercise more. When you have your patient close their eyes, the only systems left to assist with balance will include the vestibular system as well as their proprioception, and this will make it a little bit more challenging. The final exercise that you can use with your vestibular patients include gaze stabilization. This is used to help improve their control of eye movement, and we have 4 different types of gaze stabilization exercises here. I have links to the YouTube videos. I encourage you to click on those and watch the videos. Your VOR ×1 exercise, you'll have your patient focus on a target and have them move their head from side to side while focusing on that object. Your VOR ×2, you will have your patient focus on the target and move the head as well as the target. So you're moving 2 different objects. A 2-target VOR exercise, your patient has 2 targets to look at, and they're going to look with their eyes first and then turn their head. If this is confusing, I really encourage you to watch this video. They do a really good job of demonstrating and explaining the exercise. And the last gaze stabilization exercise is imaginary targets. So you'll have your patient focus on a target, close their eyes, turn their head away from the object, and then open the eyes while still having them attempt to look at the object. So again, I encourage you to watch the videos because they're great examples of how to do the exercises.